Started live artist?
Started tomorrow.
Okay. Okay. I'm a consultant orthopedic surgeon working at AIG hospitals as well as Medics Healthcare, non-traumatic faction. At these difficult times, I understand it is difficult to think about going into a hospital for any treatment. However, there are certain conditions where we can't avoid and we can't delay taking the right measures. That thought process made me think of doing a program on we can treat at home. So I'm going to give a brief overview on how we. Sorry, there's a small technical glitch here. I'm going to give a brief overview about what orthopedic specialty is. In generality, I don't want to go deep into the treatment strategies. Um, what is the difference between an emergency and an elective? Majority of the times, emergencies are ones where you can't wait. You need to deal with as soon as possible. When it comes to the elective procedures, we can wait for some time. The common emergencies, majority of the times, are due to injuries. There are some red flag conditions which need immediate treatment, which is very important to understand. Home and outpatient care, how it changes, and the hospital treatment. So in general, orthopedics and trauma is a specialty or branch which deals with bones, joints, muscles, ligaments, nerves, in total the musculoskeletal system of the body. Majority of the common afflictions of the musculoskeletal system can be broadly classified into those due to injury, those due to infection, inflammatory conditions, as well as tumors. As I said, injury is the commonest cause for the orthopedic emergencies. Among the injuries, fractures take the majority of the role. Following fractures, you can see some dislocations which need emergency treatment where the joint comes out of the socket. Lacerations, which is nothing but a cut on the skin, which depending on the size, the depth, we need to make a decision whether it needs a hospital treatment or can be managed in an outpatient or a home setting. Ligament injuries are common, particularly due to sports or road traffic accidents. Tendon injuries, muscle tears, nerve injuries and blood vessel injuries need to be dealt with on an acute basis than delaying the treatment. Compartment syndrome is one of the complications of a fracture which needs urgent treatment. When it comes to fracture, it is nothing but a break in continuity of the bone. Depending on the type of fracture, the location of the fracture, whether the fracture is in position or it is displaced, or if it is a single fracture or multiple bones are involved as a part of polytrauma, which can happen in road traffic accidents or those due to fall from height, all these need definitely hospital treatment as soon as possible. Open fractures are when there's a cut on the skin through which the bone can come out, and these are emergencies which needs definitive hospital care. When it comes to fractures which can be treated non-operatively or in an outpatient setup and followed up at home, are like closed fractures which are undisplaced or minimally displaced, which can be immobilized in a plaster for a certain period of time, which depends upon the location of the fracture. It's either in the upper limb or the lower limb, how stable the fracture is. So several parameters come into play. But majority of the fractures, when we look at as a whole group of fractures, 75% of them can be treated non-operatively on outpatient basis and at home. The 25% of the fractures will need hospital treatment, and it is important to identify which are those 25. Majority of the lower limb fractures, which are like a hip fracture or a thigh fracture, leg fractures, these does need inpatient treatment. When the look at the lower limb fractures as a group, almost 80% of the patients who get admitted with these fractures may need surgical treatment. 20% of them may not need surgical treatment, and that 20% will need some immobilization and rehabilitation based on how well they are able to cope up with the pain. Sometimes we do admit patients whose pain is not controlled well enough at home or on outpatient basis. So the initial 48 to 72 hours may need some optimization of treatment, during which we can see them in the hospital. Fracture dislocations are the other group of injuries which certainly need emergency treatment, and this need to be seen by orthopedic consultant, and depending on the location we can decide whether the patient needs emergency surgery, or we can do it as an urgent care where you can wait for 24 to 48 hours. Dislocation is when bones forming the joint are displaced in relation to each other. Every dislocation is majority of the times very painful. They can cause deformity, and they can also cause restriction of movements. Shoulder dislocations are very common. If it's a first time dislocation, that definitely needs a hospital care. So the patient has to go to the emergency care, and after assessment and doing x-rays, they need a treatment to reduce the joint. Finger dislocations are also common, and finger dislocations can be treated as an outpatient basis. It does not need admission unless they are associated with multiple injuries or fractures. The lower limb dislocations are less common, but if they happen, particularly secondary to road traffic accident or fall from heights, they certainly need hospital treatment. And foot injuries can also rank injury. This doesn't need an emergency treatment, needs surgery, but it doesn't have to be emergency. Spine fractures come under a completely separate group, and they can be stable or unstable. Majority of the spine fractures happen secondary to road traffic accidents or due to fall from height. We do see spine fractures from within when you slip and fall, very commonly in the elderly who has osteoporotic bones. Majority of these osteoporotic fractures are stable injuries, and they can be treated as outpatient. However, the challenge is to manage the pain. If the pain is not managed well at home, then the patient needs a hospital treatment. When the spinal fractures are associated with any weakness in the legs, then they certainly need MRI scan based on how the fracture is. If it is compressing the spinal cord or any of the nerve roots, then the treatment changes remarkably, and that needs to be done as an inpatient rather than as an outpatient. Hence, hospital treatment is very essential in spine fractures. Whiplash injuries of the neck, which we can see particularly in road traffic accidents when you're making a sudden break while traveling, the patients can complain of severe neck pain with stiffness, and they can be seen as an outpatient and can be treated at home. Majority of them need immobilization of the neck for a few weeks, I would say approximately 6 weeks. Following that, they can be followed up in the outpatient department. Coming to ligament injury, ligament is the tissue which goes across a joint from bone to bone. The ligaments stabilize the joints and help them in stable movements. Depending on which group of ligaments are involved, is it a single ligament or multiple ligaments, Is it only a stretch in the ligament, or a partial tear, or a complete tear? Majority of the ligament injuries which happen around the ankle, like a simple twist while playing sport or coming down the stairs, can result in swelling with pain and difficulty in weight bearing. If the swelling is not getting improved when you are taking general measures like resting, ice application, elevation, and gentle movements, and has difficulty in pain when you're walking, they certainly need to be seen by the orthopedic surgeon. Majority of them will settle down in 2 to 3 weeks time. However, if the grade of the sprain is like a grade 3 where there is complete tear of the ligament, then they certainly need a longer immobilization. In multi-ligament injuries, like those which can happen around the knee joint, as shown in this picture here, these need definite immobilization and hospital-based treatment than home-based treatment. Simple injuries or single ligament injuries like ACL tear in the knee joint, which is very common, they can be treated on an elective basis. The initial treatment would be mainly resting the limb, application of the ice, getting the movements of the knee back, and allowing the patient to walk as the pain allows. Usually by a week or two, majority of the patients will be able to walk full weight bearing. And based on the gain in the movement and the strength in the muscle, particularly the quadriceps muscle, we can make a decision at a later stage. You can wait for 6 weeks or 3 months. It doesn't have to be emergency when it comes to isolated ACL injury. It can be done as a semi-elective procedure. So those who have any ACL injuries at this time of situation, I would suggest you can wait if you're not having recurrent instability. Some ACL injuries may be associated with meniscal tear. Meniscus is a disc within the knee joint, and if there is any locking of the knee movement, definitely that needs to be seen. And dislocations which we can see around the shoulder, they may be associated with ligament tear or bank cap tear. And if the joint is unstable, then we may need to consider doing surgical management in the hospital. If there is no instability, pain is manageable, and the movements are improving, then majority of the times this can be treated as an outpatient basis at home. Muscle injuries are also common. Majority of the muscle injuries can be treated at home by using the golden rule of Rice, which is resting, ice application, compression, and elevation. Muscle injuries can be divided as a contusion, where an injury to the muscle can result in swelling with localized bleeding. There may be a tear in the muscle, body of the muscle, or the tear can be a partial or complete tear. Even if it is a complete tear, we don't often need to repair. However, if the muscle is avulsed from its attachment from the bone, then they do need surgical treatment. Proper tear of the fibers can be partial or complete. Majority of these can be treated non-operatively by rest, icing, and elevation. Tendon is the tissue which attaches the muscle belly into the bone, and is very important in getting the movement in the joint and in mobilization. If there is a tendon tear, again, if it is a partial tear or a complete tear, if it is displaced or undisplaced tear, then the treatment changes. If it is a partial tear and undisplaced tear, like a tendo-Achilles tear, which is nothing but the heel cord, we can treat them non-operatively in a POP. If there's a displacement and when we assess the tear, the tendon ends are not coming close by, then it needs surgical treatment. It doesn't have to be as an emergency. We can do it as an urgent care treatment where we can wait for a few days. Majority of the tendon tears which we see are around the heel cord. Sometimes we see patellar tendon, which is just in front of the knee, or the finger tendons. If there are any tears in the finger tendons, these do need early care. because delaying that, the tendon can get scarred up into the forearm, and that can cause long-term problems. Hence, they need urgent care. Nerve and blood vessel injuries do happen in road traffic accidents and fall from high heights, and majority of these needs emergency care. If there is any injury to the blood vessel, it can result in uh, bleeding. When it comes to the nerve injuries, the common nerves which are damaged with injuries are the brachial plexus, which is coming out of the neck going into the arm. A fall where the neck is stretched out can result in complete weakness going into the hand, or there may be a partial involvement. And this need to be assessed by an orthopedic surgeon to know whether it is a partial or complete injury, because the treatment changes depending on the presentation. The radial nerve is one which goes around the arm bone. In fractures of the humerus, the radial nerve can be damaged or can be entrapped, which can result in wrist drop. If patient has any wrist drop, then we need to know is it a complete or partial. Based on that, the treatment again changes. Brachial plexus injury, as I explained before. Sciatic nerve injury is very rare, but majority of the times we see sciatic nerve injury secondary to dislocations of the hip. Certainly, if a patient has a dislocated hip, they need emergency care. And if they have a sciatic nerve injury, the dislocation should be relocated as soon as possible. Peroneal nerve is a nerve which goes around the knee joint on the outer side. If there is any injury to the nerve, it may result in foot drop, and this also needs urgent treatment, particularly if there are any open injuries. Compartment syndrome is a complication from a fracture. It can be a closed fracture or an open fracture. When a pressure within the closed compartment increases, it can cause death of the contents within the compartment. Depending on the duration from the onset of symptoms and presentation, it's very important to decompress as soon as possible if there is a definite compartment syndrome. Majority of the patients will have severe pain which is disproportionate, which is not improving even after taking painkillers, and passive movement of the toes or the fingers can also cause severe pain. Majority of the compartment syndromes happen in the leg, associated with the fracture of the tibia or fibula, in the forearm, or in the hand. Foot compartment syndrome can also be seen following heel bone fractures. This is definitely an emergency and needs hospital treatment. When it comes to spine, the commonest problem we see is the back pain. And I have been seeing a lot of patients with back pain recently, because most of us are spending time in chair, particularly work from home for IT professionals or banking sector has made a big difference because they're spending long hours in the chair. But not all back pains need emergency treatment in the hospital. Majority of them can be treated at home or following an online consultation or an outpatient consultation. But if there's a disc prolapse which is pressing on the nerve, it can cause what we call as radiculopathy, which causes pain going into the, or if there is any called as cauda equina syndrome, where the patient may have difficulty in passing urine, or they may have lose control, difficulty in passing urine, or they may have lose control, what we call as incontinence. If that is the case, it needs emergency treatment. Discitis is infection of the disc. Majority of the discitis patients will have acute back pain, which is associated with temperature, chills and rigors, and feeling really unwell. So any back pain associated with fever, having chills, sweating, and feeling really unwell, they need urgent treatment in the hospital. Vertebral osteomyelitis is infection of the bone, which is the spinal bone. Again, here the patients will present with severe pain, not able to sit for long period, or not able to. Vertebral bodies can cause abscesses around the muscles on the sides of the spine. This needs to be evaluated and it needs hospital-based treatment. So these are the spinal emergencies which definitely needs hospital treatment. But majority of the back pains which are secondary to our work or posture, they can be treated at home by taking appropriate measures like uh, not sitting for too long, sitting in good posture, using an ergonomic chair, and doing simple stretching exercises. When we go through a lot of websites, we have measures which you need to take to prevent back pain when you're sitting for long hours. We can go through that. Or you need a physio consult to learn the exercises you need to do to improve the back pain. But these conditions like disc prolapse with foot drop, Cauda syndrome, discitis, vertebral osteomyelitis, these need emergency care. Infections in the bone or in the joint are also an emergency, particularly when they are causing systemic symptoms. Infection in the joint is called septic arthritis. Patients usually present with temperature, restricted mobility, and worse pain with the movement or even without the movement. There may be associated chills with sweating and feeling unwell, particularly those with immunocompromised conditions or those who have diabetes. They are prone to infections in the joints. And if any of these symptoms are there, the patients will definitely need a hospital care. And they may need washout of the joint by surgery and also IV antibiotic treatment. So this should not be taken easily, and this needs definitive hospital treatment. Bone infection is called osteomyelitis. These are not that common. However, if a patient has acute onset of pain in any of the bones associated with temperature, sweating, feeling unwell, and those who have, as I said before, immunocompromised conditions or diabetes, they definitely need hospital care. Prosthetic infection is again uncommon, and patients who had any implants in the body like a knee replacement or hip replacement or metals in the body following treatment for fractures, if they develop any temperature with the associated pain at the site of the implant with any redness or swelling, they need to be looked at, and they also need a hospital treatment. Wound infections can also be seen following lacerations or post-surgical wound infections. These need to be looked at by the treating doctor and make sure that there's a continuity of follow-up. These can be followed up at home by taking appropriate measures and taking the required antibiotics as prescribed by the treating doctor. Pyomyositis is a very uncommon condition I have put in there because if any patient develops an infection which is causing destruction of the muscle, and some of them can have cellulitis, which is nothing but infection of the subcutaneous tissue in the limbs, either the legs or the upper limb, with redness, swelling, pain, temperature, they definitely need treatment as an emergency. Inflammatory conditions which need emergency treatment are not common. Majority of the inflammatory conditions are chronic. However, conditions like rheumatoid arthritis can present with acute flare-up where the patients can have severe pain in the joints with the swelling and stiffness. If they have difficulty in doing their day-to-day activities and not able to sleep well and systemic symptoms like temperature, they definitely need to be seen in the hospital. This can be monoarticular or polyarticular. Monoarticular condition need to be differentiated from infection. Sometimes we may have to do aspiration from the joint and send the sample for testing. So not all inflammatory conditions need hospital treatment. Majority of them can be treated as an outpatient at home. However, when there are acute flare-ups, when it is a monoarticular joint, that means one joint being affected, that needs to be seen in the hospital by the concerned doctor. Gout is another common inflammatory condition. Majority of the time it presents with acute flare-ups. Most commonly we see in the big toe of the foot, ankle joint, knee joint, or sometimes in the fingers. We need to do some test to know whether there is any elevation of the uric acid. It is not the definitive test. Definitive diagnosis is based on clinical assessment. That's where the patient need to be seen in an outpatient setup. It doesn't have to be in a hospital setup. And majority of the gout patients can be treated non-operatively and at home. Reactive arthritis is secondary to any infection. It may be viral or bacterial infection. Majority of the time we see as a viral infection. Patients may have cold or cough, and then they may develop pain within the joints, multiple joints. Some patients who can have chikungunya or dengue fever, they can have multiple joint pains which can be due to reactive arthritis. Majority of these can be treated non-operatively and at home. They doesn't need any hospital-based treatment. Tumors are very uncommon. However, if there are any malignant tumors which are dangerous and they need to be seen on an emergency basis. Benign tumors doesn't have to be seen in an emergency basis. Malignant tumors associated with pathological fractures where the spread is into the bone, they definitely need hospital-based treatment and they cannot be treated at home. Again, we have to look at the patient, different conditions, any comorbidities. Based on taking all these criteria, we can make a final decision whether the patient needs emergency care, urgent care, or whether they need a palliative care. Home treatment in general can follow this rule. First, protect the limb, rest it, application of ice. You can apply without any additional equipment required. And as I said before, 75% of the fractures secondary to certain injury can be treated at home. Only 25% of them may need hospital treatment. If this golden rule of price is followed, you can alleviate your pain to a large extent. To take home, all orthopedic conditions are not emergencies. Displaced fractures and dislocations need hospital-based treatment. Undisplaced fractures can be treated at home with an outpatient follow-up. Majority of the fractures and dislocations, as I said, can be treated as an outpatient and at home. If there are multi-ligament injuries of the joints, they definitely need hospital-based treatment. Isolated injuries to the ligaments, if it's a partial tear or even a complete tear, can be treated at home on outpatient basis. Tendon and muscle tears, majority of the times, can be treated on outpatient basis at home. Nerve injury causing weakness needs urgent care, followed by outpatient and home care. Blood vessel injuries and compartment syndrome definitely need hospital-based treatment on emergency basis. Common, but malignant tumors with pathological fractures need urgent evaluation and treatment. Thank you. Please contact us if you have any questions on our email, or please post a comment. I will check and let you know the answers for the questions.